time to get your coronavirus questions answered live. 270-9933, the number to call.
Dr. Zorba Paster is still with us and standing by. And let's start now with Larry in Cambridge. Hi, Larry. What's your question?
Yes, this has nothing to do with the virus. I've been cancer-free for 4.5 years.
Oh, congratulations.
Yes, and now my cancer doctor called me with a visit by phone because of the pandemic, and I'm wondering now, he said, well, maybe I won't need the PET scan and the other final x-rays because the blood test looked all right. Is that all? Do you think I still have them? Should I have that last test?
Yeah, he's wondering why his appointments are getting canceled now, Zorba.
Well, first of all, I think if your doctor thought you needed the PET scan, your doctor would order the PET scan. And obviously, your doctor at this point thinks we probably don't need to have it done. So I think I'd follow the advice of that doctor. If you have any questions, you want to call them up. There's no absolute number here, but if you've been cancer-free and your doc thinks you don't need it, then you probably don't need it. One of the issues here is we do a lot of over-testing. We do a lot of testing that really isn't necessary for what we have. And now that we've got COVID around, a lot of the clinicians are now using clinical judgment instead of doing unneeded and unnecessary tests. So if you trust your doctor, you got to trust his opinion. And if there's a question, get a second opinion.
All right.
My thought is your doctor probably says you don't need it.
All right, let's go to Maria in Madison. Hi, Maria. What's your question?
My question is, Dr. Zorba, a bunch of us women and ex-nurses have a facility. It's like an assisted living. And there are some people waiting to be admitted into our facility in our homes, our assisted livings. And some of them in Madison and outside Madison nursing homes, they have tested positive. Some are asymptomatic, others are being treated and they've been sent to the hospitals. At what time, even though when we know that they're all healed and over it, when do you think we could have them come to our facilities, into our
Very good question. I think what we have to do is follow the guidelines. Now, right now, I don't have the guidelines in front of me, but it means anyone who comes into the facility is quarantined for a certain number of days. They have to be COVID negative by the latest test when they do the nasal swab, but they still have to be quarantined for a certain number of days. And those guidelines sort of continuously change. In Dane County, we have guidelines that have been developed, and basically most of the nursing homes and extended care facilities are following them. So that's the answer. The answer is they've got to be isolated when they come in, no matter what the test is, because that's the safest thing to do. The number of days determined by the best medical care and the best numbers at that time.
All right, let's go to Dennis in Verona. Hi, Dennis. What's your question?
I had one of them tests done at the Coliseum. And I wonder how long it takes to get the results back.
Oh, I'm not sure exactly about that. It takes a few days to a week or so. Get the test done and the result isn't back yet. You can certainly try to give them a call, although, frankly, they're probably pretty busy about that. Certainly, I would expect the test to be done within a week, but I want to caution you. There's a false positive and a false negative on the test. So if you test negative, it doesn't mean that you don't have coronavirus. It means you probably don't have coronavirus because the tests are not perfect and we're missing a certain percentage. It's either 10, 20, or 30%. So you've still got to social distance yourself from other people.
All right, let's go to Susan in Janesville. Hi, Susan. What's your question?
I want to know if it's safe to go to the dentist.
I'm going to go to my dentist next week and get a tooth cleaning. I think they've got pretty good things. They're following the Dental Society protocols. That's what I'm assuming. You can certainly call them up, but the dentists are really good because they protected themselves from HIV when that came up, and I think they're protecting themselves from the coronavirus. Now, for my dentist, he said, we're going to be in the automobile when I come there. Somebody will come out, check my temperature. If I have a temperature, they'll say, thank you very much, and they won't see me. And basically, they're going to ask me a few questions. So if you've got a good dentist who's following the protocols, I think it's safe. Call them up and ask them. Make sure they're following the American Dental Society and the Wisconsin Dental Society protocols to make sure you feel safe.
Yeah, they're used to infections and keeping safe. Right. All right, James in Sun Prairie. Hi, James. What's your question?
Yeah, hi.
Go ahead.
Yeah, hi, doctor.
Hi.
Hi, how are you?
Good, thanks.
All right, I've been on prednisone for about 22 years now for Addison's disease, and I've been self-isolating and being safe.
Sure.
And I know I'm high risk, but is there anything else I can do to help me prevent the virus? I mean,
You bet. You bet. You bet. So Addison's disease is where you're not making enough prednisone steroids, which are in your body. And what happens is you're then put on replacement dose, but still your ability to fight infection is reduced when you have Addison's disease. So the answer is the best thing you can do is self-isolate, be really careful, be scrupulous about hygiene if you do go outside, and that's the best thing you can do. And if you have a problem, call your doctor right away just to be sure the problem may not be another infection which you have to have treated. You are at an increased risk, and that means you've got to take extra special precautions.
All right. Wait for a vaccine, apparently, in the long run.
Right.
All right, Zorba, thank you for your time. Thank you all for calling in. We'll see you next week.
Thank you, Zorba.
My
Good
pleasure.
to see you.
Well,
Take care, guys.
You
Stay
too.
safe.
Well, the final check of your forecast coming up.